Now, if we get to the money pages, right? It's a section called "Making the Star Ratings Work for Beneficiaries and CMS." Talks about how CMS has nearly complete authority to modify all aspects of stars. Talks about MedPAC and some other think tanks that have recommended changes, and this is kind of recapping some of those key changes, right? So I think there are 4 of them, and then a couple of recap comments. So the four proposed changes to make stars better. Okay, first, rather than using the current long list of measures that may be gameable in the current system, CMS could consider reducing the number of measures to fewer, more relevant options, as others have recommended. While plans favor removing compliance measures, MedPAC and others suggest including more universal quality measures such as readmission rates, which I think is already in there. In our view, measures should be based on outcomes salient for beneficiaries that can aid in their decision making. This could include rates of prior authorization and claim denials, network adequacy, and access to care, and reported negative experiences with plans. I know we touched on some of this too, right? And I know what I was saying was readmissions are already in there, so I don't know what if they're looking for more, or if they're just using that as an example, right? More quality measures where outcomes are important, such as readmissions. Obviously important. We have several of them in there now. Talked about prior authorization. I think we all said, yeah, that would probably be good to add. It's in queue already. It's been proposed. I think it's been proposed, but it's in the it's definitely being considered in the future, right? Prior authorizations, just getting plan feedback on it.
Yep.
And then denials, claim denials, network adequacy, access to care, and negative experiences. The negative experiences we talked about, we have complaints already. CTMs is a measure. So reported negative experiences with the plan and with the drug plan they both count heavily towards stars already. Now we don't have grievances, which that's a much bigger pool of negative experiences than complaints. Complaints are the most, I guess, egregious. Maybe it's the ones that where the member actually calls CMS to notify them of the grievance against the plan, if you will, as opposed to just calling customer service and saying, I'm not happy. So maybe there's opportunity, to include grievances, or the grievance rate or something like that. You guys jump in here. What are your thoughts here?
I really like that they mentioned the universal measures, right? Because when you think about, what it takes to do well in star ratings, it's really a partnership between the health plan, the provider network, and really its membership. How well do we communicate with our members to help them understand the value of showing up for preventive care and, being a team with the health plan and keeping themselves healthy or maintaining their health. So I think from a universal measures perspective, when you think about lines of business, there's so many health plans that don't just have the Medicare Advantage line of business. They have multiple lines of business. And so it simplifies their quality efforts so much when those measures are like a thread that they can pull across all their lines of business and really optimize the types of interventions they do, the communication they do, the investments that they make in people, process, technologies across their lines of business, because the universal measure pulls through all of them. So I think that's an important point that they make. CMS has recognized that. We see everything about, we see a lot of talk about the universal measure set, not just in proposed rules, but also they refer to it like in the advance notice, in the final notices that we've been seeing lately over the last few years. Those have been a predominant feature, talk about the universal measure set. So I think that's an important thing. The other thing that I recognize is something that we say all the time amongst ourselves, that if you connect members with the care, medicines, and information they need when they need it, that's really what they're saying about the measures that measure things that are salient to members. Those are the things that are salient to members, right? Are you paying my claim? Are you answering the phone and answering my questions, giving me the info that I need? And can I get the medicines that I need, right? That my doctor has prescribed for me. Those are all the things, the minimum operational things that a health plan has to do. And I think that's what the article is really like leaning into. Like those are the salient things for members.